The federal opposition has warned of a looming health disaster in regional and remote communities and is demanding greater transparency on vaccination rates of Indigenous Australians. From the start of the pandemic, Aboriginal people were identified as the clearly defined vulnerable group, and concerns have been raised over low vaccination rates. Joining me live now is Linda Burney. She's the Shadow Minister for Indigenous Australians. Linda, thanks so much for your time this morning. The situation
Good morning, Laura.
in West Dubbo and Walgett is one that gives us great anxiety every day when we see those case numbers. Can you tell us about the situation there and what you know?
Yes, I can. And the other thing that you may not have caught up with is that there is now confirmed cases in the township of Bourke and some in the central west, including Mudgee and Orange. The case numbers are growing exponentially in West Dubbo, and they're growing in Walgett. A majority of the people affected are First Nations people, and about 40% of those people are under the age of 19. It is like watching a slow-motion train wreck what is happening in the Western Division of New South Wales.
It certainly is. I didn't know about those cases. So we know there was sewage testing in Bourke in particular, and you're now saying there are now confirmed cases in Bourke, Mudgee, and where else?
I think the other town is Orange.
Okay.
But there's 2 confirmed cases in Bourke. I think there needs to be urgent sewage testing in the township of Wilcannia. Because I would be amazed if there are not cases in Wilcannia as well. What's really important for people watching to understand is that they are very remote communities. They are almost entirely Aboriginal, about 80-85%. They are in rural settings. Some of them have GPs. Some of them have very small hospitals. The hospital, for example, at Walgett has 4 beds. Certainly not in a position to cope with the outbreaks that are going on. And I think the other thing to say, Laura, is there is a lack of coordination, and what really works and what is needed and what people are calling for is for people to go from door to door to deal with the issues of getting vaccines, also screening for COVID,